honored colleagues, dear friends. Humbled by the distinguished work of my predecessors, let me first express my gratitude to Dr. Barb for your excellent work as president the past year. There are many more I would like to thank. First, the Swedish Medical Association for putting your trust in me and supporting my candidacy. My appreciation to all the colleagues at the office for your tireless work. I especially thank the board with Presidents Sofia Rydgren Stale and CEO Hans Dahlgren for your valuable assistance. I extend gratitude to Eva Fernvall for prudent advice over the years. A special thank to my wingman on international assignments, Thomas Hedmark, always on time, always on track. With your assistance, my duties have been made easy. My gratitude to Björn Zoega, CEO of Karolinska University Hospital, for your support during my year as president-elect, for your confidence in me and including me in the leadership of the Karolinska University Hospital. My deepest gratitude goes to my family, my two wonderful children, Nora and Fröja. You have spent many hours underneath boardroom tables or in the back of a conference room waiting for me. Thank you for your patience. My dear parents, who have supported me and always been there for me. You have secured the family logistics, and you are the most wonderful grandparents. I could not have made it without you. Thank you. Colleagues, with over 230 COVID cases since the start of the pandemic and more than 4.7 million deaths, we are challenged. But we are fighting back with more than 6 billion doses vaccine given so far. All of us have faced personal and professional challenges during the pandemic, and a virulent virus still ravages our world. Healthcare has been pushed to the limit. Physicians have toiled on the front lines, risking self and family to provide care to countless patients having fallen ill to COVID-19. The working conditions have been beyond challenging. Many physicians have become victims of the virus, and some of us have died while caring for others. The pandemic has shown that we share a very small world. What happens in one place of the planet affects us all. The butterfly effect has never been demonstrated more poignantly. Viruses know no borders, but neither do medicine or the ethics that guide us. The pandemic has put some grim ethical and moral questions onto its tip. How do we prioritize care? How do we prioritize vaccinations? And how do we distribute resources? Patients, populations, and governments look to us for guidance when health is at stake. And these difficult questions about ethical practice of medicine must be addressed. The WMA must lead the way, providing firm foundation to respond to these challenges that remain critical to every man, woman, and child on the planet. Ethics is core of the WMA. The health and well-being of my patient will be my first consideration. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare, words we promote and pledge by which we live. The WMA policies are frameworks and guidelines implemented by physicians and institutions every single day all over the world. Next to vaccine, global cooperation is the most crucial component to fight disease and this virus in particular. No other physician organization has the inclusiveness and reach as the WMA. Therefore, we need to help bridge governments and borders. We can foster more robust cooperation between international organizations. We must continue to engage in and cooperate with the WMA on issues of common interest. Initiatives to prevent pandemics and distribute vaccines has a greater chance to succeed if the agreements are in place. The pandemic has highlighted the importance of medical research and development. Vaccines, their development and distribution have been at the center of the pandemic, and the speed with which vaccines has been developed is awe-inspiring and demonstrates what can be achieved on a global level when there is an emergency. Medical research always raises ethical questions though, and even more in situations where there is intense pressure to achieve results quickly. The pandemic has put us under extreme pressure with expectations of revolutionary research results, demands for new therapies and vaccines to be provided to patients quicker than ever. Under such conditions, ethical guidelines are crucial. And there are our guidelines. The WMA Declaration of Helsinki, guiding in ethical issues related to medical research involving human subjects. This core WMA declaration must continue to be well known. It must continue to be a relevant touchstone of ethics in medical research. At the core of good research and good medical practice is a solid basis in evidence-based medicine. There has been and continues to be fear-mongering information, misinformation, and false claims. Some of these claims are highly concerning and present potentially serious health risks. It is our duty to speak out against fraudulent claims, just as it is to explain science, making it easy to grasp and comprehend. Moving forward, this will be an increasingly important task for the WMA. To the quote, test, 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 made by Tedros, Director General of WHO, I add, vaccinate. Many physicians and researchers have worked tirelessly to get us back to a normal life. Thinking about a normal life again, we should remind ourselves of the necessity to ensure a sustainable life for all of us on the planet. Nature continues to be an essential source for developing new treatments. The new vaccines are such examples, partly founded upon research in biology. But if the loss of biodiversity continues, we will be less resilient. The WMA has vital policies on environmental issues, and I stress the importance of achieving sustainability. Our future patients' health depends on it. As physicians, our colleagues worldwide stand at the center of health, and the WMA should be the global guiding light for all of us. Please help me continue to build a strong international voice for the WMA, a voice that speaks for every physician on our small planet. Thank you for electing me as your president. The honor humbles me. I will do my best to represent you and the WMA.